Thank you. Good morning, everyone. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on this Tuesday, April 21st, 2026 at 8:31 a.m. First item is the approval of the consent agenda, which includes our meeting agenda, the minutes and financial report, and abstracts and bills. Any changes to our regular agenda or any items anyone would like to pull from the consent agenda? Commissioner Gamble.
Thank you, Mr. Chair. I approve the consent agenda as presented, and also would note that Chair for the Public Health Human Services Advisory Committee, Frank, is attending to family with health issues, so he expresses his regrets.
Okay, thank you. So that's a motion. Is there support? Yeah.
Support.
Okay, thank you. We have a motion from Commissioner Gamble, support from Commissioner Sullivan. Any further discussion? Hearing or seeing none. All those in favor? Aye. Those opposed? Motion passes unanimously. Thank you. Moves us on to our staff report, and I'll pass it over to Grace, who will pass it over to Kristina.
Well, I will, before we start our staff report, I want to introduce you to our newest staff. Avi Sukhwal joined our team on April 1st as the public health supervisor, and he is starting off strong as co-presenting with Kristina Mattson, who's our SHIP coordinator, and Carol Stender, who is a community member of our Food Access Council, and also a board member at the Grand Marais Food Shelf. So before we start the presentation, I just want to take a moment to introduce Avi and welcome him to our department and to the community, and introduce him to you all as our board. So.
Good morning.
Good morning.
Nice to meet all of you.
You as well. You had a great interview on the radio. Thanks for doing that.
Oh, thank you.
Yeah.
No, it was fun. I got to meet their dog over there. That was I mentioned that every time I talk about it.
Oh, yeah, that's awesome. Yeah.
And also, you're still up at the Heights?
Yes, I am.
You moved in and he's staying, so just how that connects with our housing issue, so.
Yes, well, we love it over there, and my wife and I just unpacked our last box.
Wow, impressive.
Really enjoying it there. So
Yeah.
nice view and everything.
Good. Welcome.
Great.
I think I moved maybe 8 years ago, and I still haven't unpacked everything. Good on you.
Oh,
You could just toss the boxes.
Well, thanks for joining the team.
Well, before we start the presentation, I also want to say part of the impetus for giving the food presentation today was, as we wind down the pop-up pantry in the lobby, to put that initiative into the context of food access more generally in the community. And since planning this, we've also learned about the closure of Ruby's Pantry, which I believe makes the topic even more timely, as it is something we're discussing in the Food Access Council. So without further ado, I'm going to turn it over to our presenters to get us started, and we'll take it from there.
And I'm just going to start with handing out this resource that we utilize with our community right now, just for you to look at while we're presenting. This is, because the slide we have for our resources is not comprehensive, but this is more of our
Thank you.
comprehensive
Thank you.
resource we utilize.
Thank you, Kristina. Thanks.
And we need some updates. Last time was updated was in November, but this is what is most current that we're using right now.
Kristina, I did give you a microphone.
Oh.
So you can speak into the microphone as you give the presentation, and we're going to have to sort of pass it around.
Start
like
there.
musical chairs.
Super. All right. Thank you.
Okay, well, thank you so much for having us. We are looking forward to giving you an update regarding food access. The purpose of this presentation is to inform you folks, our board, about the current resources and future ideas regarding food access in Cook County. We'll go through current food access resources, coordination of efforts in Cook County around food access, what things are improving regarding food access for our community, how we're planning on expanding access to healthy foods, key questions for future access efforts, a data collection plan, and then next steps. And then I will hand things over to Kristina.
All right. right, we'll go to the next, do I do this myself? Oh, there we go. All right, so looking at the slide here, we have our current food access resources. So you have in front of you that guide that resource that we compiled. Also want to give some kudos to Erica. She helped a great deal with that resource and creating that. So it was definitely a team effort, as is all of the food access collaboration efforts in this county are always a team effort. So my position, just to reiterate, I'm the State Health Improvement Partnership Coordinator, and so my job is to create policy, system, and environmental change, and I help bring partners together to improve health. And so I just want to reiterate, this is always a partnership effort. And so I'm just here to present on behalf of all the partners that work together to do this. And so we have the Grand Marais Food Shelf, and they serve 120 households in March of 2026. You'll see that graph on the side. It shows the access how the food shelf has been utilized, and we can see that the rate of utilization has gone up quite a bit, and we don't foresee that really changing. We see that the need is going to be increasing. And look at WIC, over 40 families participated in 2025. In 2025, SNAP average monthly numbers, households are 121, persons 209. This includes 140 adults and 69 children. Our backpack program, which is a program where children kindergarten through high school can receive food in their backpacks once a week. In addition to that, they receive a voucher for $10 for vegetables that can be spent, or produce that can be spent at various locations throughout the county. And that program is utilized currently by 40 children, 40 children at ISD and 12 at GES. The Hub, which is our senior center located next to the co-op, has a dine-in option of approximately 30 meals per day. And what meals they don't, I talked to Chris yesterday, and she told me what meals they don't serve. They end up packaging as frozen meals that people can take with them, buy an additional meal and take with them. And those are the meals that are also packed up and distributed through Meals on Wheels. And so daily, 24 households are served daily. That's a mistake on the slide, said weekly, daily. And so they have drivers that go out daily to a 5-mile radius of the county, of the city, and deliver those meals. They are in need of drivers, and it's about an hour commitment a day. And if there is desire for a driver to go further than 5 miles, that's kind of up to discretion of the driver. But right now, the only expectation of a driver is to go the 5-mile radius of the town. And most of those meals are distributed to various apartment complexes and some private residences, according to Chris. So there's a need there. We have our free and reduced lunch program. Well, yes, Minnesota, all children get free lunches and breakfast. The free and reduced lunch program is a federal program, and so those who qualified it still is a great indicator of need. And 28.9% of school-age children in Cook County qualify for free and reduced lunch in 2021, according to the Children's Defense Fund. We have pop-up distributions. Remember during November we had the government shutdown, and so when SNAP was on hold during that time, there was a great mutual aid effort throughout our county. And some of those resulted from the pop-up pantry that's right now in the courthouse was one of those mutual aid pilots that happened. And it really did illustrate the need for greater accessibility for food access in our county, because a lot of feedback we received was that the ability to access that pop-up during business hours it was really beneficial. So we have one at the courthouse. We did try a survey, but most people didn't fill it out. But we can just, through anecdotally watching the volume of the pop-up pantry increase and decrease. And the model was that people could come and donate, and then people could come and receive what they needed anonymously, without question. Take home what they needed, and it seemed to be a really popular model so far. But filling that gap when the food shelf isn't open. The YMCA has a table at either entry. And then I reached out to the Hub when I was talking to them about their current efforts. They are actually looking to, in response to Ruby's Pantry closing, this isn't publicized, you guys are the first to know, but they're looking to start a pop-up pantry there, similar to the one at the courthouse. And so they're very open to working with Empty Bowls, with the Food Access Council, and the food shelf, and any other volunteers who want to help with that effort. It sounds like they're open to looking at seeing how they can help fill those gaps in a similar way to how the county pop-up was. And so in light of the one here sunsetting, it's really great news to know that the hub will have something that I think will be filling that gap. So that was really great news. And so I'm happy to providing them some technical support and helping them get connected with the Food Access Council to help support their efforts. Second Harvest, Northern Lakes Mobile Food Pantry, they serve 100 to 150 shares monthly, and that is at the community center. And then they go up to Grand Portage. And that food is, they get a protein, you get, what else?
A protein, a dairy, and as much produce as they are able to give out that month. It varies.
Yeah, and it's loosely income based. It's an on your honor. You say you're within a certain. They're not really checking. You go up. It's free, and it's a pretty high quality distribution. So that's it's a really great asset we have in our community. And then the Ruby's Pantry closed, and so that provided an average of 110 shares in the winter and 180 shares in the summer. And that was open to anybody, wasn't need-based. It was about $25 a share, and there were plenty of also vouchers for free shares if people needed it. No one was turned away if they wanted a share of Ruby's Pantry. So that has been closed. I think it's completely, that program is over. I don't believe that any area has Ruby's Pantry anymore. It's not just us in Grand Marais. So that's just, and then you have in front of you that resource document that we utilize to hand out to those families that are coming into the county. It's also distributed in community centers and the clinic and all other areas around the county. Take a look at that. If there's anything you see that we are missing or that maybe needs to be corrected, please don't hesitate to reach out. It's a document that is definitely dynamic, and we continue to update it as needed.
Kristina,
Yeah.
do you have the data for the years before, or is it just this year that on the screen just switched? Do you have the data for previous years
On which one?
on the food access resources? Like, you have the statistics to the left. Do you have other years?
What years are you looking for?
Well, it looks like we have 2024 and 2025, and then 2025 and 2026.
You have
So anything
previous
before
years.
that?
I mean, we can look at the, every annually, the food shelf, they do a statewide survey. And so, and also the food shelf itself hands out surveys. So we can talk to the food shelf and find out what the previous years were, if that data would be helpful. I know based on the year-over-year data statewide, that they have found the percentage of use has gone up considerably post-COVID.
Has the population in Cook County increased that significantly?
No,
But the data has still gone up?
yeah,
Okay,
yep.
thank you.
Yeah, no problem. I see what you're saying, have we had an increase of population that would statistically, I don't believe we have had a statistically significant increase of people moving to Cook County that would, yeah, I see what you're saying. No.
Thank you.
Yeah, Deb.
Just a clarification, so I thought we were not suspending the pop-up food shelf here in the county, or in the courthouse, but we're keeping it, or not keeping it, or we have?
The plan, is this on too? I don't know.
Yes.
I'll talk loud. So the pop-up is still out in that lobby right now, but I would like to sunset the pop-up and help transition the food between the food shelf and the hub's new pop-up. So it is still there right now.
Okay,
But
because someone
we-
asked me, and they said they heard it's gone, and I
Well,
said,
we are planning to sunset it, but we haven't sunsetted it as of today.
okay. Well, the person was very relieved to hear that was still going to be in this location,
Okay.
so.
One thing we
future,
could look
for the
at doing
future.
is making sure there's signage where the pop-up has been that indicates where you can go, to the YMCA, to the hub, to the food shelf, so that if someone comes and the pop-up isn't there, that resource is right there on, I think
Yeah.
that's a good idea.
And the hub plans to start publicizing theirs May 1st. And so we're working on that transition plan with sunsetting ours and then helping support the hub. Okay. So the Cook County Food Access Council started in 2023 and then moved under the county as a county-led council in 2025. Prior to that, though, or was it 2020? 2024, thank you. My years are all coming together here. And so during that, we did some asset mapping at the beginning. And so what you're looking at there is some of the asset mapping that we did initially in 2024. So looking at, I mean, I don't know if we want to go granularly here, but just to have this as a resource for you to know, this is some of the work that we've been doing with our collaborators within looking at the federal, state, Northeast Minnesota, Cook County, and then looking at all the different ways of like local program systems, food sovereignty, retailers. So just looking at how comprehensive a food access system can be and the ways that we've been looking at it comprehensively. Coordination efforts. So I did mention before our Cook County Food Access Council. It's been meeting since 2023 and moved under the county at 2024. And our mission is the Cook County Food Access Council brings together partners to strengthen people's ability to grow, access, and prepare food through educational programs, local services, and advocating for systems level changes that reduce hunger and food insecurity. And our vision is we envision a resilient food system where everyone in Cook County has regular access to healthy food. And we meet the first Wednesday of each month from 1:30 to 3 p.m. at Cook County Higher Education via Zoom. So we do currently have 9 council members, and it's a very well-attended council, and we have collaboration. These are all of the partners that are part of that council. We have a Graham Ray's Food Shelf, the Community Volunteers, University of Minnesota Extension, Cook County Community Center, Sawtooth Mountain Clinic, Grand Portage, well, former Ruby's Pantry, but a lot of Ruby's Pantry people are in. There's lots of hands and lots of different cookie jars. I feel like cookie jar is a good metaphor for food. And so Clearview General Store and so forth. It's a really collaborative project and council, and we're really working to break down silos to ensure that everyone in the county is communicating with each other so that we can have collaborative efforts and to make sure we are when we're actions taken, everybody knows what everybody's doing, and so that we aren't being reiterative, or if there are things that are happening in various parts of the county, we all know what everyone's doing. We can work together to collaborate and create effective and efficient solutions, and work together to create those solutions. And one of those has been what's improving. So I'm going to hand this over to Carol to talk about one of the collaborative things that has happened.
Hi, I'm Carol Stender. I am a actual very recent board member of the Food Shelf, and my participation came about due to the Food Access Council. I attended a couple of meetings, and one of the meetings early last fall, we had a presenter from University of Minnesota Extension who gave us the outline and the impetus to take a look at our current food shelf and to see if we would be willing to move to what the University Extension created, which is the super shelf model. And I kind of got a kick out of the super shelf. I started thinking super Target, supermarket, what is that? Anyway, coincidentally, about a month or two later, our Food Access Council met in the lower level of the UCC church where the food shelf is. And I took a look at that and I thought, we can do better. And so I started thinking, getting involved, and the difference between what we were doing and what the super shelf is, basically, is before clients would come in, they'd fill out this short form, name, address, verifying that they qualified for the income levels here. And they were given a container of food and some vouchers. And we said, well, see ya. And that was it. So you're a person coming in there, you take your box, you take your vouchers, the end. And the trouble was that they didn't have any choice. You know, what was in the box is what they got. And sometimes they would leave some things there, or they would leave some things in the grocery store, drop-off places, or here and there. Super Shelf turns that into a grocery store type atmosphere. Now they come in, they fill out their form, and we have produce laid out so that everybody has an opportunity to take some fresh food and from week to week even. And then we have grocery carts, and they can go through the food shelf to the different categories, pick out what they need, what they can use. There are certain limits on some things, but for the most part, it's pretty open. And nobody is in there saying, oh, you took too much of that, or there's none of that. And in this whole transition, the Food Shelf Board decided that they needed to amend their mission statement because they had been operating strictly as an emergency food shelf. That's how it originated. And moving into this model, clearly we had moved beyond that, and in fact, the population had moved beyond that. We are to a point now where the food shelf provides a very significant part of people's monthly food needs, and we're happy to do that, and happy to be able to provide good food, and we're looking further to find good food. One of the things that we've done in that category, as you can see by our slide, we're very proud of it, a brand new display freezer. And in the works, we will get a refrigeration unit that matches that to put right next to it. So that it really does look like a grocery store now. We have the little shopping carts, the same ones you see at Johnson's. And I think people really feel empowered to select their own food for their own needs and not just take what's given to them. Our new mission statement says, we are committed to serve with dignity and respect those in our area who are in need due to financial difficulties or emergency circumstances by providing them with nutritious food and other resources. And I like this mission statement particularly because it starts out talking about dignity and respect for the people who come in. We understand that, there's a certain amount of stigma attached to not having enough money to provide food for your family. And we really want people to understand that we don't feel any differently about them than we would anybody else coming in a grocery store. And we're limited in space. I was able to get 6 more feet from the bike guy in the lower level down there. But at least it gives us enough room so you can take your grocery cart and make a turn. The other thing that we're doing just recently is we talked with Johnson's and Co-op and asked if we could order food through their suppliers, and so that we can access more fresh produce. Mm-hmm. And they both agreed, and they also agreed to do it at cost. So that's a huge benefit to us and to our clients, that they can get fresh food. Often the stuff we get from Second Harvest Northland is kind of on the edge, same sort of things we got at Ruby's. my husband was the site director, Phil Grave, and I was the volunteer coordinator for Ruby's. And so I feel right now I have a cadre of volunteers that I can call on. There's many here in Cook County that were regulars, and there's also many that come in the summer that live in the rec park, and they would come to Ruby's. So we do have some resources here to draw upon. What I'd like to do is increase our trained volunteer base so that we could be open more hours. Right now, our hours are somewhat limited, 3 to 5 on Mondays, and then the first Wednesday from 4:30 to 6:30. I would like to extend at least one of the Mondays into the evening till 7 o'clock on Mondays. I'd also like to do a Saturday morning opening for a couple hours on Saturday. And now, I think with the increased number of volunteers that are floating around out there, who I have their email addresses, I can call upon more volunteers and we'll train them so that we can get open more hours. We also are collaborating with Northwood,
Food project.
what?
The Northwoods Food Project?
Yes, the Northwood Food Project of folks locally that are growing things. And we have purchased things from the Thursday farmers market. At the end of their market, if they have leftover, we will go and purchase things from them. But we're also involved there. They have recently presented a grant that would give us money to buy food from them and then have that locally grown produce in the food shelf, which would be really quite lovely. Crystal.
Will you be changing how this works during the summer? Because we will have people that are not from the county.
We have quite a few of the foreign students that come in the summertime, and until we switched gears, they did not get as much in vouchers as other people, and there were several of us on the board that thought that wasn't right. And so as of, I think, November, we changed our policy so that the students that are here temporarily are treated just like anybody else that lives in Cook County, so that they get the same amount in vouchers and the same dignity and respect at the food shelf as anybody else. Their issue is primarily is transportation. So I know that Bluefin occasionally will bring a van, and the workers from Lutzen this winter, they all were crammed into somebody's Jeep Cherokee. It was kind of a, cops in the, clowns in the little vehicle with food coming out of everywhere. And people were walking, my goodness, this winter. We gave rides, actually, some of our volunteers at the end of the shift would give rides to the students that didn't have any transportation and were living down by IGA. And so transportation continues to be an issue. And that would be throughout the county, throughout all of the food access, that's an issue.
Commissioner Storlie.
I want to add, though, that Arrowhead Transit has created time for they will, if you call ahead, they have a route now for those who live within the area to get picked up and dropped off at the food shelf on Mondays.
Who's this?
The Arrowhead Transit? Yeah. Sorry, I didn't mean to just jump in there. But
It's okay.
Yeah.
As far as distribution, the food carts that are in the grocery stores, does that go to the food shelf?
Yes.
Okay. Excuse me. And then also, the distribution of fresh fruits and vegetables, does that come from any of our local stores?
Not right now. that is what we're hoping to,
Okay.
we're working on that. Ann Haig is a member of our board, and she's taken that on as her mission.
Okay. Great work. Thank you for what you do.
Yeah.
Sure.
Commissioner Campbell.
Yeah, thank you, Mr. Chair. Thank you for the information. Thank you for the energy, too, that you lend to looking at things and creating new ways to make it more user-friendly. We talk about this at our extension meetings. We talk about it at the community center meetings. There are 4 bills that I know of that are on the legislative floor this session, all having to do with food access. And to Crystal's question as to the demand, I think because we have various sources that have been used, if we see the same people at each source, or if we see, various people, that means we have a distribution in our population accessing food through different channels, then that's harder to track that as to need. But in Association Minnesota County's legislative update yesterday, they referenced that the increased demand, food shelf demand, remains high, with 1 in 9 Minnesotans experiencing food insecurity.
I saw that.
I think if we look at our numbers, and it's difficult, like I say, because of the diversity of options, but just looking whether the demand exists or not. 10, 12 years ago, when we were exploring the possibility of bringing Ruby's Pantry up here, the question that was raised in some of our meetings was, is there really a need? And I said, is there really a need? Look around and see what's happening with the food shelf and thing. And but over the time, we've seen that when we talk about food access, it's like, if I can use the analogy, if you take your children to the grocery store with you, their cart would be completely different than your cart. And so when we talk about food, it is also food education relative to what is actually providing nutritious food that helps you, not just substance that you eat. Because what we need, and this is much of the discussion when it comes to fresh fruits and vegetables, and trying to cultivate that. In the bills that are before the House and the Senate in this legislative session, there is a bill that is prepared meals funding, and it's a proposal for $1 million in one-time funding for a prepared meals grant program to serve 750,000 meals annually to populations not covered by federal programs. There's another bill, agricultural support. It proposes over $18 million in 2026 for agricultural growth, and $1 million annually for buying milk for food shelves. And there's a bill, local food purchasing, which establishes grants to procure food from local farmers for distribution in food with priority to unrepresented farmers. This is an area where we would like to see and encourage more, realizing the need and the benefit that farming provides. We know what our growing season is like, we know what our soil is like, but I think the ingenuity and the things that we see when we have farmers markets, you will find there's a significant trend in the population shifting to farmers markets because they realize that this is the food that keeps them well. And then the other is the Rural Food Access. That's the continued advocacy for Grocer Investment Option Act to support small independent grocery stores in rural high-needs areas. So basically, when we look at the efforts that you are investing yourself in, we're looking at this, your previous slide that says, how do we coordinate with various agencies that provide these things? Our awareness of that and our resourcefulness in that area helps us to be able to do a better job of what we do locally. So we certainly, as commissioners, and I think this is true, especially in our area, that we want to advocate for these things that are partnering and provide resource for us.
I wanted to mention that I really appreciate you bringing up those grants. So the Food Access Council also has a subcommittee, which is a grant working committee, and we meet as needed to discuss various grants that come forward to ensure that we are looking at those collaboratively. So we're working not again, so we're not all competing for the same pots of money. And if there's ways we can come together and collaborate to have joint grant applications, or looking at which nonprofits locally are the best candidates. For example, there was recently a grant through the Mardag Foundation, and it looked at how to increase food access for BIPOC communities, indigenous communities, rural communities, and we reached out to Vital North, which is a nonprofit in the area that's working on food access, and we also reached out to Grand Portage, and in those collaborations, the Grand Portage, we talked to Jared Swader and a couple other people from Portage, and they decided to apply for that themselves. And we offered, to provide letters of support and any collaboration that we could do to help support their application, to help support food sovereignty and food access and food system development up in Grand Portage. And so, we're actively looking at those grants and ways that they can be applied to our area, looking at who are the best candidates to apply and who has the capacity to write the grant and manage the grants. So yes, I really appreciate you bringing that up, because those are definitely things in our purview and on the front burners of what we do. Is often we have a line item most of our meetings just talking about grants and ways that we can utilize those dollars most effectively in our area. So that's one of the benefits of having the Food Access Council, for sure.
Mr. Chair, as a follow-up, it's one of the questions that I had, is your funding sources, how that breaks out when you're making purchases in different things, or if there's in-kind. But I think the public would be interested in knowing how are you funded?
That was one of the revelations that I had when I joined the board. Gwen and Bill Lentz, you may know, have been running that food shelf for 20-plus years, and bless them, because they have done just a spectacular job. And so I interviewed Gwen for information, and I said, what do you do for fundraising? And she said, nothing. And I went, really? I've never been part of a group like that didn't do any or didn't have active fundraising. And people just give them money. That's where it comes from. They I think finally this year, maybe for the first time, they filled out the little application for the Empty Bowls grant. Before they didn't, they said, gee, we really don't need it. And I thought, well, I'll find a way to use $5,000. Thank you very much. But it's donations. There are some people that just give regularly, and it comes in, and financially we're doing fine. We had enough money to put in the extra electricity we needed for our new display refrigeration freezer models. We had the money for the shopping carts, and we have money to buy produce. So right now, we're doing very well with what we get. Just I don't know. It just comes in the door. I mean, like I said, I've never been part of a nonprofit group that can just sit back and say thank you, thank you, thank you, and not go out and beat the bushes for money. So, yeah.
Ranna?
Yeah, I just want to say that the purpose of the bikes that are there are for the foreign students.
Right.
And mostly given out in the summer, but if you see someone that is walking, hook them up,
This was in the winter.
Oh, they probably could even use them sometimes, at least like right now, for
Yeah,
sure. So,
right.
Okay, thanks.
Yeah.
Mr. Storlie?
Thank you, Mr. Chair. One of the great things is the expansion of the community gardens.
Yeah.
So at the Extension office, they've had theirs for many years. We're in our third year at Birch Grove School for the community gardens.
Yeah.
And when they were going to be first established, it was like, how many should we do? Maybe a dozen. No, do 24 plots, because it's going to grow.
Yeah.
And it is growing.
Good.
There's a few empty spots left.
Commissioner Gamble.
Yeah, I appreciate the discussion. I think it is another example of the community that comes together to support things that individuals believe in. We've seen it in other established organizations within our community that when need exists, that those that have the means contribute to that. And I think that model is a model that is important to affirm and highlight. Years ago, in my first term, we had the chamber come and request funding to be able to beautify Grand Marais by painting, fishes on gas tanks and different things like that. The idea is a good idea, but I don't think we can make it part of the levy when it puts a burden on the people, many of them, that we're trying to help. But if the community believes in that, we give our resources to those things we believe in. And if that funds those efforts in our community is beneficial, that is a model that we need to highlight and affirm, because it doesn't become a burden to others just because we have something that we are passionate about. So I think we need to weigh things in that context, and it's testimony to the people that, as you say, many non-for-profits are looking for funding, any mechanism just to keep their doors open. And it's evidence of the people that are empathetic and caring and give their resources to something that has value for our community.
Thank you, Carol, for everything you've done, moving this forward. It's been really, really great to see and gratifying to see. Thank you for all the work. I know it's you and so many others on that board that have joined the board and really have helped to bring this forward.
Yes. It's been a group effort, absolutely.
And just a key word of dignity. With so much dignity and so much collaboration, it's been, and dignity for those who attend and dignity for everyone who's been running it, and just so much respect for all the work that's been done and all the work that will continue to be done in the future to help evolve and grow the food shelf to better meet the needs, to continue to meet the needs of our community. So just thank you. Sorry, I just wanted to give you a little applause there. It's been really great to see. So moving forward with our presentation too, I also wanted to mention too with the pop-up locations, the hub says, unlike the pop-up location here at the county, the hub has refrigeration and freezer space already available to utilize for providing some fresh options for a pop-up pantry, which were some of the things I know that were brought up in regards to the pop-up pantry here that were some gaps. So it was refreshing and really wonderful to hear when I was talking to the director of the hub yesterday that they are looking at dedicating space. And, if they have enough support and enough, there's demand and support, they're looking at, if there's options for expansion or if there's just options for greater collaboration with the hub. So I'm really, really, it's a really promising partnership to keep exploring and looking at. So, and I think it's part of how they saw what happened at the courthouse and how they thought how it could be emulated there. So I just think it's a really great that, we try something, we take a risk, we do something here. Another community partner goes, I could do that. And now it's expanding to a place that I think can really create some options for filling those gaps. So I'm just really excited to see that happening as a partnership coordinator. So questions, I think expanding access, like you said, some of the challenges are staffing, volunteer support, transportation. So we continue to look at those challenges. Moving forward to key questions. I don't know if we want to move it here or there. We're going to kind of musical chair this microphone around. Can you guys hear me okay without the microphone? I'm getting over a little bit of respiratory, so I just want to make sure I'm projecting well. So who are we reaching well? Who is still not being reached? Are there geographic or access barriers? And what gaps exist beyond food availability? It's not just insecurity, it's also accessibility. And so both those factors come together, and so those are things that we are continuing to ask. And so we're going to be doing that in a data collection plan, which I will hand over.
Just 1 second. It's a little bit further away. When I'm not talking into the mic, it can be a bit of a problem, so.
Oh, and also the mic's largely for the video stream,
Yeah.
just for online.
Yeah.
Wonderful. Well, hopefully they can hear me okay. So, we have ship-supported work where we partner with the food shelf to distribute surveys. We want to do some focus groups with varied engagement tools and even one-on-one key informant interviews or just general informant interviews. We want to focus on individuals who are currently utilizing services and individuals who are not utilizing services but still experience food insecurity or access challenges. We're hoping to collect data in the summer and then report back in the fall. And we're hoping to get 2 types of data. There are basically 2 types of data. There's quantitative data and qualitative data. So quantitative data are like the numbers and facts and figures that we kind of showed you
On the first slide.
on the first slide with the cool charts and all that stuff. Qualitative data is the story behind why that's happening. And oftentimes when we are looking at things like food access and food insecurity, the best way to collect data is qualitative data. It's understanding what the barriers are, how the barriers are affecting them, what the disparities of health are. And so that's what we're hoping to gather with the focus groups or listening sessions, as well as the one-on-one interviews, and then using the surveys as our quantitative backbone. We also have a variety of other data resources regarding food access that we'll be using as well, including utilization for SNAP, WIC, and food shelf numbers.
How did you determine the timeline? Because it seems like summer and fall, I've noticed, I've only been here for a year, but it seems like the population shifts. There's more people here during the summer and in the fall than they are during the winter. So how did you pick the timeline?
So I can hand this over to you, but for me, when I think of data collection, the best way to collect data is to have good, rich numbers for the quantitative side. And for the qualitative side, it's having enough people who are willing to interview from different walks of life. So as we know, Cook County changes depending on the seasons. So in the summer, in the spring, we have a lot of folks who come in for different work outside the county. We have a temporary migrant population who comes in, and understanding the disparities of food access for that population as well as our general population will allow us to have a better understanding of food access overall. So we thought that summer would be a really great time to collect information, not to mention, well, you know, it's probably a little bit easier for people to meet us and for us to meet them where they are when we can like drive on the roads quite easily, you know, just pop on down to where people are at. And you're also going to see an increase of numbers of people utilizing things like the food shelf and pop-up pantries during the summer. So we'll have more access to the numbers as well as their stories.
I'm just curious if that would be actually a representative of the community, since a lot of the summertime people aren't here during the rest of the season. So do you understand?
We could look at doing like a both and. So
Yeah.
maybe we have some initial report backs in the fall
Yeah.
and see if there's additional work that could be done in the winter months to paint a fuller picture.
Yeah, thanks for saying that. And also some of the qualitative and the qualitative data would be asking, you know, those questions. And so we can then delineate based on looking at the data when we're processing it, you know, who is a Cook County resident, who's coming in, you know, we can parse out, oops, sorry, my hands. We can parse that out. And so we can kind of create some more of that granular data that would maybe be kind of what I think you're asking about.
Could you include a question that says where
Yep.
you live during the winter?
Absolutely. Yeah, I think that's pertinent and an important thing to delineate, and especially when we have different populations that we're serving at different times of the season, which I believe is a really important thing to ask, because the needs of, in the winter, when those particular populations aren't here, and then we have that surge of people, it's definitely going to impact, how we deliver service and the needs of those who are accessing, for sure. So it's a really good question to ask. And to Grace's side there too, we're looking at just kind of being preliminary, creating some timelines, and, creating more longitudinal data is not necessarily out of the question. We just want to make sure we're being timely and looking at, getting something to you guys and knowing when to expect it and to have some timeframes for this data collection. But yeah, does that help answer your question?
It does. Thank you,
Awesome.
Kristina.
Thanks. I also wanted to mention one thing I didn't mention earlier is one of the things with the Cook County Food Access Council and the Northwoods Food Project and the Sawtooth Mountain Clinic, they are actually piloting a prescription produce program. So they're going to start prescribing food to, I believe they're going to have 10 pilot patients. They're going to be receiving some CSA. My understanding is, I'm not sure exactly how it's being implemented, but I know that there's going to be something with the farmers market and the Sawtooth Mountain Clinic and providers, and ensuring that we're doing the educational piece and the food piece, and then following that up with some of those indicators of health. I don't know which ones they're utilizing, if it's going to be, I don't know which patient populations that they're utilizing. I'm guessing it probably might be different lab markers they can use to determine effectiveness. I'm not sure. That would be something to definitely follow up with the Sawtooth Mountain Clinic on looking at how they're going to be measuring success or measuring impact. But that program is moving forward, which is wonderful. So that's another thing I want to make sure you guys were aware of too.
Commissioner Gamble had a question.
Yes, I'm sorry, I didn't mean to interrupt you there.
Sure, appreciate that. I applaud your efforts to ask the quantitative side. Oftentimes, statistics are used to demonstrate worth, but the quantitative side, it addresses not just the number of people served, but the real need that is being met, and it informs decisions so that you realign. Once you really know your audience and need, then you can position yourself to meet real need. It's similar to demographics. You can get demographics, but the psychographics are why people make the choices that they make. And so I applaud the fact that you're doing that, because it definitely means that we care enough to really understand, not just to have the numbers that we show who we're serving. It's why this need is important. So I applaud it.
There's a lot of qualitative data effort going across. When the SHIP coordinators, we work regionally and we communicate with each other and we share resources. And so there has been in Duluth and regional food access efforts across the 5-county region that my grant is applied to. And so they've been utilizing what is like the 100 cups of coffee and other varied engagement tools. And so we're not hoping to recreate the wheel, but just help to have that, to utilize what the engagement tools and evaluation tools that have been utilized across the region, and then also individualize them to Cook County. But also that's going to provide us an opportunity to provide some regional data as well. So if we're asking some consistent questions across the region, we can then utilize that data and process it to create some real great rich data that's not just Cook County, but the Arrowhead region itself too. So I'm part of that collaborative effort.
We move on to the next
Yes.
slide.
Yes.
Yeah, there we go. So, we will continue to support current efforts. As Kristina said, she'll provide some technical support, as well as PHHS is part of the Food Access Council. We work very closely with our food access partners. We are going to then gather data, and then we will do a data analysis and come back with a report for you all. Eventually, the goal is to do it by the fall. So collect the data in the summer, bring it back by the fall. If we feel like we need to do more data planning around getting a better or bigger picture of our more local community, then we'll collect more data and then come back to you with a secondary report. And then we'll bring the findings and future communications to you all. Communication is key when it comes to things like food access. So you haven't seen the last of us. We'll be back around with the same topic sooner rather than later. Does anybody have any questions?
One thing I was hoping we could maybe just touch on, Carol, is you had brought up at one of the Food Access Council meetings just the potential space needs or restrictions, and I just didn't know if you wanted to touch on that at all, what you...
We tried hard when we were considering moving to the super shelf model to get more room, more space. And like I said, I got 6 feet. But we did go to the various churches, and there wasn't anything available, nothing available. Just yesterday, with this news that the hub was willing to support the pop-up, they also mentioned that they have more space, potential, and this, it's not for publication yet, although we are going over the airways. We'll explore. Okay, let me say that. We'll explore and see if the hub would be a good spot for the food shelf going forward. One of the things that hit me right off the bat was many of our clients at the food shelf are older folks, and they may well be down at the hub anyway. So, if you put it all together, that would be lovely. There was a time I talked to Kristen, probably 6 months, shortly after she started, and asked her, is the county featuring any space? They're doing law enforcement stuff now. You're talking about courthouse remodel, et cetera. And she talked about potentially the recycling center being decommissioned or put someplace else, and that utilizing that building not only for the county, and she was talking about perhaps moving the Health and Human Services folks over there, and that we could have the food shelf there all in the same space. And I would love to see all of those things together. Grand Portage has that all together, and they have their social services in the same building where they have their food shelf, and they also have clothing, seasonal clothing and whatnot there. And I think that would be a wonderful thing. When I first joined the Food Access Council, we were brainstorming, and my brainstorm was the Golden Dome. And the Golden Dome was having all your social services in one spot, so that it, kind of one-stop shopping for the people that utilize those services. So there's always things moving around, thank goodness. Change is fun, I say. I'm old enough to say that now.
I just want to reiterate, the stuff with the hub is very preliminary, and it would be, we were looking at even it being like a satellite too. Yeah.
Well,
Just very
Exploring.
if we have extra support, there's lots of potential for opportunity there. But I don't want to put the cart for the horse.
that far into it, so.
But it's really, for now, though, they're really, really excited about creating a pop-up pantry there and exploring how it could fit, how other options for food access could dovetail into what they're doing there already.
Commissioner White?
Since I sit on the hub board, and I've been part of that energized conversation that they were having about, well, we've got room.
Yeah.
We've got room, and it's they're getting a new refrigerator unit, and I mean, they're working on it.
Yeah.
And they've got a grant writer on board and everything, but the enthusiasm for opening that space for more options for the community, to benefit the community, is unbounded. So I think it's, and it would be, you can walk to the hub. You don't have to walk uphill to the hub.
Right.
Maybe uphill home, but, and it's a very open, inviting space. So I think that would be good.
I really like the idea of opening it, but, it got couched as a senior center, and to really open it up to the community as a community resource, and not just for one specific population. I think that's and I think moving the pop-up to that space would encourage that sort of change in attitude about what this is.
Right, and if you ever saw the people who hung out there, besides those that are getting their toenails clipped, You wouldn't, you wouldn't actually identify them as seniors? Or maybe they're seniors without having learned the rules of being older and wiser. So, no, it is a very welcoming place for all ages.
Yep.
Yeah, the hub was a great collaborator when, a couple summers ago, when for the food, was it the summer food program with the schools, they were able to help transition over there to help provide. And also, Chris wanted me to make sure to mention that the meals that they provide are not just limited to seniors. Anybody is welcome to reserve a meal. And even if Meals on Wheels is also expanded now beyond seniors. Anybody who is needing access to Meals on Wheels at their home, they can call and reserve the meals with the AEOA. So I just want to make sure that you all knew that it's not just for seniors or anybody who's in need. They can call in and also can come get meals. So, thank you so much for the time too. Oh, sorry.
Commissioner Gamble has a question.
Yeah.
Comment.
Thank you, Mr. Chair. Again, appreciate the conversation. What I would say is brainstorming is unbounded, and the benefit of that is just we learn things that we would have never explored had we not taken away the fences that keep us from thinking outside of the box, as they say. The realities that get applied once we've done that dreaming is just trying to be practical with what we have, and but wouldn't want to discourage the dreaming side of looking at what could be. The other thing I would say is that the senior center, which became the hub, and I sat on that board in my first term, we're always looking for ways so that there wasn't a stigma associated with the services that they provide. And we can do that by words and naming and branding, but when we do it by the services we deliver and the culture we create, that is where we see that hoped-for outcome. And certainly by providing services and things that introduce people to all of the services that the hub provides is definitely a benefit. So it's something that they want, and they've been working for years to try to create that different branding, and that's why the hub. But this certainly would be an opportunity, and we, as commissioners, as we've explored facilities and our options there and our limited resources, the creativity and the approach to that has been something that we continue to explore how we can do this and do it well and do it as fiscally responsible decision makers. So.
Maybe pass it on if they did a Mario Kart tournament monthly. That would bring in some different folks, I bet.
Yeah.
A what?
Mario Kart.
Yes.
Oh.
Maybe we can get our sons on that.
That's, yeah. Join the
It's
board.
I believe that group is open to anything
Yeah.
type thing. So the space is there, the attitudes are right. So, yeah, I think it's great. I know they do the Christmas program, I forget the official name of it, but making certain that all of our residents, families have an opportunity for sharing gifts with our community members, and that is now at the hub. So going down to the other end of the spectrum too, so.
Thank you.
Thank you for the opportunity to present. And if there are any questions, don't hesitate to reach out to me or Carol or Avi. So thanks again. And then to reiterate, Food Access Council is open to all. And our next meeting, we hold our meetings the first Wednesday of each month from 1:30 to 3 currently at the Cook County Higher Education or via Zoom. It's on our county website for more information.
Thank you.
Thank you all for presenting.
Yeah.
All right, that moves us down to item 4, the director's report. I'll hand it back to Grace.
All right. All right. Well, I thank again our wonderful presenters for providing some information on Food Access Council, food access efforts in the community. Thank you for being here this morning and for all the information. I'll move us into general departmental updates, starting with HR updates. So as we began the meeting, again, welcoming Avi Sukhwal as our new public health supervisor as of April 1st. We also, this past month, have accepted the resignation of Marina Fujimoto, who's an adult mental health case manager with our department. Her last day will be at the end of May. We've reposted the adult mental health case manager position. We have started interviews, and we are looking to fill 2 vacancies, which are both in our current org chart, for an adult mental health case manager role. So please help us to spread the word. That is all for HR updates. So as promised, I will continue to provide updates on how we're working through recommendations from the Birch Bark Consulting report that Megan Mose shared with the board at its last meeting. This past month, Plamen Dimitrov, our fiscal supervisor, Olivia Bonander, who's our adult services supervisor and also acting as our children family services supervisor, the 3 of us have come together and we've been working on a policy on time reporting expectations in SSIS, which is the Social Service Information System, that for our social services staff. We have a policy draft which we expect to go into effect in July of this year. We introduced this policy to our social services staff, obtained their feedback, and between now and July are working with staff to provide them with training and supports so when the policy goes into effect, they will be ready to meet its expectations. And those are related to the amount of time that's required to be in the SSIS system and the amount of that time in the system that's related directly to client services. So that is really our first focus in terms of implementing the recommendation from Megan Mose. My next kind of category of updates is related to mobile crisis response. So in the past month, we've received a proposal from First Call for Help to become the provider of record for mobile crisis response services in Cook County. What this would mean is that First Call for Help would hold the license to provide mobile crisis response services, which the state of Minnesota mandates across all counties. In this proposal, First Call for Help would directly employ local responders for both daytime and after-hours response, as the service must be available 24/7, 365. Currently, Cook County directly staffs this service, contracting Brightwater, formerly HDC, to provide after-hours coverage. We currently have 2 grants with DHS to support mobile crisis response services. Under the proposal we received, these grants would transition to First Call for Help, at least one of them would, later in the year. And in future years, the mobile crisis response grant would go directly to First Call for Help rather than to Cook County. And First Call for Help would directly provide mobile crisis response services within the community. So First Call for Help is a community-based nonprofit in Grand Rapids. They have a 25-plus year history of successfully providing mobile crisis services in Itasca County and a portion of Aiken County. They're also the regional call center for 988 across the Arrowhead region. They specialize in mobile crisis response services and have built a programmatic infrastructure to skillfully administer the service, which includes the software, the policies and procedures, the staff training. All of that infrastructure is something they have in place. Under the proposal, they would work closely with us and PHHS to ensure that the service remains locally staffed and embedded within Cook County. I'm inviting First Call for Help to share details of their proposal and share more about themselves and their agency with our advisory councils at their May 5th meeting. That would be a joint meeting of our local mental health advisory council as well as our PHHS advisory council. I want to make sure that our advisory councils have time to hear the full detail of the proposal, ask questions, provide feedback. I've also invited them to attend our May 19th PHHS board meeting so that you all are able to hear directly from them what it is they would propose to take on. And you can also have the opportunity to ask questions and hear the full context before coming to a decision. Between now and then, if there are particular pieces of information that you feel like would be crucial to include, please reach out and let me know. I've set up regular meetings with First Call for Help and also the Arrowhead Behavioral Health Initiative, because I want to make sure that our local partners have all the information and ability to ask questions that they need to be able to make an informed decision. And I'm hoping that at that May 19th meeting, the board feels ready to vote on the proposal. It's certainly up to you all, but the reason for that timing is that if we move forward, we will have to create a contract amendment with DHS, and that could take some time. So I don't want anyone to feel rushed, but I do want you to feel fully aware of what the time considerations are for the decision. And I wanted to provide you with the level of detail that I have now as to what this might entail. So I'm going to give the rest of my report, and then I'll offer the opportunity for the board to ask questions. There, on a state and federal level, once again, I'm going to include in my written report the links to the DCYF Program Integrity Federal Funding Tracker, as well as the DHS Program Integrity Fact Check website, because there continues to be a number of services that are in federal litigation at the moment. There's nothing that has changed specifically, with the exception that DHS did put out a media release last week that there continue to be challenges between the state of Minnesota and the Centers for Medicaid and Medicare Services, as the Centers for Medicaid and Medicare Services, also known as CMS, continues to withhold federal payments for Medicaid in the state of Minnesota, which could have a potentially large impact. So I'm linking to that media release as well as to those resources, because this is a dynamic situation that involves a great level of detail. So I'm going to continue to sort of provide that highest level. At this point, there's no change to service provision locally. However, these are things that I'm watching, and I want you to be aware of where you can find accurate information if you'd like to watch those closely as well. Finally, I'm going to end on a very positive note for kudos for our staff. So starting with a preview of next meeting. So Blauman, our fiscal supervisor, has completed our 2025 year-end financials, and our May board meeting will start off with a presentation from him as to what those year-end financials look like. So this is going to be a packed meeting. It will start with Blauman giving a year-end financial report, and then move to First Call for Help, outlining their proposal for mobile crisis response services. So the summary of those year-end financials is included in today's board packet. He will be going into great detail as to what that summary actually entails as you drill down deeper into the programs and services that our department provides. Also, a big congratulations to the fiscal team for receiving the Calendar Year Financial Reporting Award for 2025 from DHS. And this is for perfect performance in submitting all required quarterly reports by their deadlines. So big kudos to Plowman, as well as Andy DeBauer and Leah Leonard, who are our fiscal team, in their excellent performance throughout 2025. And then also congratulations to our economic assistance team for exceeding the state's threshold for timely processing of SNAP and cash assistance applications. So there's a statewide benchmark, and they have exceeded that level for their performance on processing applications in a timely manner. So we have fantastic staff in PHHS, and it's always wonderful to get kudos directly from the state for their good work. So kudos to them. And with that, I am going to open it up for questions.
Commissioner Campbell.
Thank you, Mr. Chair. Thank you for the report. And I would say, in noting the kudos, that it's significant that that recognition came at a time when the pieces were moving so much. So to be able to accomplish that with the extra backpacks you were carrying, and that's it underscores even more the achievement in view of that. I would say that also relative to the things that affect us financially, in the discussion yesterday, AMC legislative update, there were two areas, and I had a brief conversation with Plowman this morning, just on how this is represented in our financials under the state reference to behavior health funding costs. And that is something that, in the discussion yesterday on the updates, that the increase could affect counties by up to 50% in that particular area. I think when we go to the May discussions on budget, that when we look at the trends and we see the things that are shifting that we can control and the things that are shifting that we can't control, that the narrative that informs that financial discussion to anticipate that will be really beneficial. And if things stayed the same, then it makes it a little easier for us to be able to, support recommendations based upon our trends and what we're witnessing. When things change in how we play the game, so to speak, it's an adjustment that sometimes can be very impactful on our budget overall. The other thing that affects us, in my understanding, is that the governor has proposed phasing out contracted case management for human services by July 1st, 2031. That's 5 years out, and there's a lot of change that could happen in between that, but the plan would burden cash-strapped counties with new expenses while limiting access to specialized services some local governments aren't equipped to provide. The Minnesota Council on Disability has expressed concern regarding these changes, citing current county staffing shortages and the need to ensure continuity of continued care for those receiving services. So this would be one of those issues that if they're talking about it, we don't want to assume things will continue as they have continued when it's been a resource for us. And that's why we as commissioners and as region and as the AMC need to advocate based upon the realities and how that would impact us. So just an observation in that regard.
Specific to the contracted case management, we do not contract out our case management within Cook County. We have the staff locally providing the service, but it would be.
And that's great. And it what I'm not aware of in some of those areas, I know we've talked about some things where we're using outside resources and how that links actually to how we do things, and that's good, because that's a protective thing for us, that some of this thing won't affect us because of the fact that we do that internally. So I appreciate you making us aware of that.
Yeah, absolutely.
At least me.
Yeah, I'm happy to answer any questions as they come up, and if I don't, we can get to the bottom of it.
Commissioner Storlie.
Thank you. A question and a comment. All across the country in NACO, we have been discussing what the implications are of the Medicaid situation, especially when it falls back onto the counties to say, you're eligible to work, get a job, keeping track of all that. So between now and our May engagement with NACO, we're all going to come together to maybe support each other with some possibilities of what one state is doing and another state is doing, so we'll collaborate and hopefully come together on the implications of how that's going to affect public health. The second is, what was the date again, as we're going to all talk about the mobile crisis response with the first?
So we have our advisory councils. We'll be talking about it there on May 5th, and then at the next PHHS board meeting in May. So that'll be on May 19th.
Okay.
And for May 5th, we have Commissioner White and Commissioner Gamble on our local advisory councils. There would be room, wait, no, that would break quorum. Never mind.
if there is interest in participating in that May 5th meeting, we could see about noticing it as a
Posting.
public
Yeah.
meeting so that more could attend.
Maybe just in case we should
Yeah.
do that, so there's lots
I'll
of time.
start going down that path.
Yeah, thank you.
And the time on that again is
Oh,
May 5th,
is it 1? Okay.
1:30?
1 to 2:30.
1 to 2:30.
And there will be a virtual option. They're going to be joining us virtually for that, but they will be here in person on the 19th.
Thank you.
Are there any immediate questions we should ask, or any, knee-jerk reactions or thoughts? Just to give a heads up to Grace, she can, regarding that potential transition. I spoke with Grace earlier, and I think, one of the things I just wanted to make sure was there was somebody here locally providing it. It's the supervision and license, and so that
Yeah.
was answered. And I didn't know if there was anything else people had concerns about, or what I liked about the concept, and devil's maybe in the details, but is just that expertise and that experience. They're built for it, so that gave me a lot of hope there.
One of the things that I found really compelling is that they also looked at other places in the state that are in some ways similar to Cook County, in that they have, they're rural and remote, and they have people living in, all areas of the county, but not in a high-density way. So they looked at Lake of the Woods and Clearwater counties as counties that do have functional, successful mobile crisis teams, and how those teams do their work. So I feel like that familiarity with how the service is provided in more rural parts of the state is a real benefit. And they did really emphasize to me that it would remain locally based, that they would be here. The plan is for them to come. If all of this moves forward, the plan would be for them to spend a solid week here, really meeting with our partners and trying to get to all four corners of the county, because we would need people in all four corners of the county who are interested in training and to be responders, regardless of whether that stays with us or goes with them. It's just that this is their specialty. This is what they know and do well. So I think that would be a huge benefit to explore the relationship.
Commissioner Storlie.
And maybe could we get a reminder about the May 5th? Just a
Yes.
blast for that? And then also, is it on Zoom? Will it be in public?
It's on a Teams link. It's a hybrid meeting, so we are going to have space upstairs in the PHHS conference room, but then there's also a link to join remotely.
Okay. Thanks.
Commissioner White?
Grace, that you're saying 1:30 on the 5th of May?
1 to
o'clock.
2:30.
1:00. There's a Prevention Coalition meeting that they'll have to
Yeah,
to choose. So I want to hear about people coming.
okay. Yeah, that's unfortunate. I think there's really no perfect option here. So, but yeah, it's unfortunate that there's that overlap.
All right, please.
And I would like to add that the combined advisory committees, was that just last week? I
Yes.
really liked that. I got a lot more out of the discussions than when it's just the mental health, adult mental health advisory. So thank you. I hope
Thank you for that feedback.
finishes or continues.
Commissioner Campbell?
Yeah, thank you, Mr. Chair. Another thing that was brought up at the AMC legislative update was the out-of-home placement plan requirements. And looking at the financial that's included in our packet here year-to-date to March, it looks like we're on target for what we budgeted here. We're at 20% of budget. The discussion, as it relates, the reason I'm bringing up, when we're looking at childcare issues, and that was something we were going to focus on in our community leadership meeting next, that this House file that has been presented is to modify to include early childhood education, childcare programs for children in foster care who have not yet reached the age of compulsory school attendance. So how that affects us in looking at dollars and a program and administration and looking at our out-of-home placements, which in the past, if these two are connected, is that's one of those things in a small county, just a couple families, and it's huge on how it impacts us. So
That is huge. That is one of our more unpredictable expenses.
yeah.
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 All right. If nothing else, we're going on to items for board action. That's item 5. There's nothing there, so we can move on to our committee reports. Item 6. We'll start right at the top with the Active Living Steering Committee, Commissioner White.
It was canceled. It did not happen.
Any report from AEOA?
Yes, I had that right here. The big thing was that, that's Ginny's thing now. There was a retirement and award recognition for Scott.
Oh, yeah.
Long history of community action programming and well respected. So that was the big thing. And then got into it, and then, as happens, I was zooming in, and it disappeared.
Oh.
Like, where are you? I tried they were all busy, of course, they're having
Sure.
a meeting, so I couldn't get back in. So,
Do you know, is the new director, will he be coming up here and
I don't know.
saying, hey, okay.
I think that.
I don't think I've met him before.
That was, it was a discussion or a statement early on,
Okay,
so.
okay. Thank you. AHA.
Arrowhead Health Alliance, Joint Powers, they just continue to hold a good bottom line. They have the facilities, Yellow Leaf for kids and young adults who have needs for, they have needs for mental health and/or addiction, and a pretty upbeat facility
Yeah.
there. I mean, I talked to some of the kids that were there. And though the conversations were guarded, it seemed like they liked this place, which is very good.
Yeah. Thank you. ARC, Commissioner Gamble.
Thank you, Mr. Chair. At our recent meeting, last Friday, we had focused on having discussions with our local tribes, the Fond du Lac Band from near Duluth at Grand Portage, of course, in our county, and the Bois Forte, which are near, that Chippewa tribe is near International Falls. Much of our discussion, and it was a very good discussion, in addition to the tribes being there, we also had Wendy Spry, who's the Tribal Relations Director with Minnesota Department of Corrections. In the discussion, it was expected that trying to cultivate healthy relationships and relationships that are substantial in what they're able to accomplish other than just for appearance's sake. It was expressed that this can be accomplished, and these are comments coming from representative of the tribes. We're reminding people to have open minds and open hearts when we come to these discussions, respect for tribal sovereignty, and continuing open dialogue between tribes and the Association of Minnesota Counties. I would say the discussion, and we've had a few of these, and I think Commissioner Wright maybe was on the board as the additional representative from our county in 2025, that we are seeing a coming together, more of a comfortable dialogue that takes place as opposed to plotting and positioning. It just a lot of people, there's vulnerability in the discussion, and when Wendy had mentioned about open hearts and open minds, I appreciated the fact she identified those two things, because I think when you realize somebody's heart is towards you, you tend to open your mind. I mean, when you don't feel that's the case, it's hard to be open-minded because you're always questioning what's the motive. And so it was a very good discussion. One thing that we've seen, and it was talked about, was the fact that in 2024, we brought a tribal assistant probation officer up at Grand Portage, and he's been doing a great job. And the comments that are coming back from members of the tribe that are able to, meet with one of their own, it's Bobby referenced, examples of that, and he was there, the representative to speak that issue. Also, on that note with probation officers, there's an interview scheduled this Friday for the Grand Race open position, and the probation officer in public health in Grand Portage will sit in on that interview process. And another topic that was discussed was the legislation change regarding age of delinquency, and that was brought up yesterday in the AMC conversation as well. They're proposing that we would change that from age 10 to age 13. There's a lot of issues. If you look at the statistical things, we talked about being informed through monitoring and understanding our experience, that if you look at violent offenders who are under age 13, by moving it up to age 13, you would be including a number of individuals that in our experience have committed significant offenses, which we do not want to change it, because what happens, should we go to the higher age, that those who commit offenses as they would need child protection services rather than being deemed delinquent. And so that would have a lot of change that we'd have to look at. If, in fact, this legislation were to move forward, then ARC is proposing that there would be carve-outs in the language to protect when there are incidences of offenders under age 13 that would still need to be treated as delinquents and not through child protection services. So remains to be seen. The number of points that were brought up, it is something that is not a certainty. Originally, it was scheduled to be enacted by August of 2026 to take effect, that language, but at this point, it's still being debated. And the last thing is that it's ARC's 50th anniversary of the Joint Powers Agreement between the counties in the Arrowhead region. So 50 years ago, we committed to work together on this, and as I've said many times, Arrowhead Regional Corrections is the model for how we deal when people make decisions that aren't the best decisions, and there's consequences for those decisions, that if we come alongside with the evidence of heart in trying to help people and affirm their value and change their behavior, ARC does an excellent job.
Thank you. Commissioner White?
And I would like to add from the probation officer up in Grand Portage, as he pointed out, is that he sees his, charges, or the people he works with, he sees them everywhere. And as he's pointed out, just because I'm seeing you at this baseball game doesn't mean we are meeting. Mm-hmm. But, so I still expect that you will be there. And I think he is also providing a real social link for many of his clients. That it's a deliberate social link that they didn't have otherwise. So I think it's going to be another award-winning exercise that people should turn and look to.
I'm sorry, I maybe missed it. Commissioner Gamble, could you remind me the motivation for the age change?
Well, here's what...
I know it's not for sure thing, but just...
Yeah, you know what spawned this initially, if we have a date that it's supposed to be enacted, which is August of this year, then obviously it was something that was discussed and then moved on, and then there's been some concern about what happens. I think after the fact, maybe we saw it through one lens and then decided, no, we need to rethink this. And certainly ARC is concerned about this. The key details regarding the proposed policy language change include elimination of age increase. The proposed bills remove previous statutory language set to take effect on August 1st of 2026, which would have classified children under 13 who commit offenses as needing child protection services rather than being deemed delinquent. Retaining current standards, the legislation keeps 10 years of age at the minimum age of delinquency in Minnesota, allowing for the prosecution of serious offenses for children 10 and under. Our shift in focus, while initial proposals aim to raise the age to 13 to keep young children out of detention, updated discussions focus on the adequacy of the current system. In other words, maybe it's working, we don't need to change it. And the implementation concerns regarding the complexity and fiscal impact of changing the age to 13 led to proposed delays ensuring the justice system retains oversight. So again, I think there's things that have come up. What, again, began this discussion at some point way back when, I don't know how way back when is, but if implementation was August 1st,
Yeah.
we just looked at something that said we'd maybe change this and it would be implemented in 2031. So, but you can see that there's a lot of discussion that questions. And
Yeah.
if in fact at ARC in our discussion, it were to become law, August 1st, 2026, that we would change that age from 10 to 13, then ARC is advocating, as well as MACAC, that they would carve out language
Yeah.
to make sure that we aren't having violent offenses considered to go to child protection services.
Yeah, I think I have heard discussions about it, and my understanding was the reason for the change was because they're still kids, like to 13, you know?
Yeah.
Even if there is a violent offense, and so the type of treatment or just where their brain is developed and that sort of thing, it still is very much a kid. And so I was just like, well, why not do it? But it sounds like it's a money thing, right? Like if child protection.
Well, I think, I mean, looking at it from all perspectives, that the financial, the implementation, the administration, you look at what's good about this and what's potentially challenging about this, the risks that we take in making this change in legislation. I would argue or counter that they're still kids. In our present-day culture, a child isn't the child that used to exist when we were kids or when I was a kid. And so there's a lot of things that we see of influences with the access to media and everything else, and the themes that a lot of entertainment are taking that have made kids no longer the kids that we see. And a lot of that is how the family manages that, and many of our homes and families are fractured too, which is another vulnerability. So I think when we look at this, both of them, where's the child at, their psychological ability to be able to assimilate and process things, that this is why we don't combine kids with adult offenders. We're not trying to put them in an environment where influence, because their vulnerability and their youth. But looking at this and all of the components, I would hate to say that this is something that is driven financially when we don't understand the human component, but. So.
Yeah, that's just what I heard as the the greatest impact of changing or not changing is just that, is that, so I don't know, but I'm no expert on it.
And what I would say, just speaking generically, any time that you propose a change, what's the rationale that supports that, and what's the risk, potential risk? And sometimes, because of prominence that gets placed or priority on a certain aspect of something, we see that as defining our direction as opposed to an honest evaluation of the big picture that says, well, I mean, we heard a comment this morning earlier about change is fun, but change, the opposite of that is change sometimes comes back to bite you if you haven't made real informed decisions.
Thank you. Child Care Solutions Subcommittee, any meeting?
I haven't heard anything about that. I
can-
don't know how often.
So,
Oh.
the Child Care Solutions Subcommittee was a group that Nancy Deming was leading while she was here as the Child Care Coordinator, and since her resignation, the group has not restarted.
Okay.
I am aware of the Community Leadership Team meeting in May, and I am planning to attend that. And I have had some kind of initial one-on-one conversations with providers about coming up with some kind of like a summer summit to just discuss childcare and sort of get a shared sense of a shared assessment of where things are at with childcare in the community. So at this point, we don't have the group active. However, I'm hoping that in the summer we can regroup and figure out what our path forward looks like. So more to come, but that's where the group stands right now. We just don't have staffing to run it.
Oh, okay, thank you. Is it, I would like it on our committee reports.
I would
I'm
like to
hoping
keep it there
yeah.
because I'm hoping that we can re-engage. It's just paused at the moment. So
Okay.
that's
great.
that's the update.
On this topic, I met with our new EDA director, and he has a particular interest in childcare, and so I'm
That's
going to
wonderful.
be inviting him to the
Yeah.
leadership meeting, and then hopefully.
I look forward to meeting him as well.
Yeah, pretty exciting. Community Health Board, yes, we met, and let's see, the kind of the hot doctor topic this time was on tick-borne illness, and I'm not going to remember the name of the Lone Star ticks disease. It's like galls.
Alpha-gal.
What's that first?
Alpha-gal.
The first.
Alpha-gal syndrome.
Alpha-gal? Okay, alpha-gal. Yeah, and it was very, very interesting. Showed a map of where there are confirmed cases, where there are suspicion of cases, and the Arrowhead region has a very high suspicion of cases, but and I have an acquaintance friend who has a confirmed case, but the thing I learned from that presentation is you can heal from it. As long as you don't eat red meat or mammalian meat for 5 years or something like that, and it's just a very strange, like, with most allergic reactions, it happens maybe instantly or within 2 hours. With this, it's you eat mammalian meat, and then after 6 hours, you'll start to, and so it has to get into your bloodstream, and that's where the reaction takes place. So it was pretty fascinating, also scary, but yeah, it was.
And you're not making this up.
No,
It's for reals.
that's true.
Mostly in the south. I've heard of it mostly in the southwest, but the map really showed Arkansas, Missouri, as kind of the hot spot. So
Maybe there's a connection with armadillos.
one never knows.
Maybe they're moving
If
north.
it's in that south, yeah.
And they are moving north.
They are
actually.
moving north.
Yes, and we're not talking about armadillos. They might be too, but the Lone Star tick is
Contrary
is-
to
Yeah.
public perception, armadillos aren't born dead along the road.
Yeah, yes.
They carry it.
But yeah, that was interesting, and just always appreciate the doctor's reports there, and he's always open for any curiosities we might have. So if anyone's curious about something, yes.
Is there any outward sign, like a red spot or something that you've been bitten by this particular tick? Or do you have to eat a hamburger to know that?
I think, yeah, and the testing is also, well, I don't know. I can't remember. I don't think it's a special rash. It's just that your symptoms, I think, lead to that suspicion and then the diagnosis eventually. So, and he also said, you can have this antibody in you and not ever show signs or ever come down with the syndrome. So it's just a pretty mysterious thing, but it's gaining a lot of attention. There's a lot of doctors either seeing more of it or being more suspicious of it throughout the country, and so it's an up-and-coming disease, yeah.
And so do dogs? Are they susceptible? Just curious. I mean, is it another vaccination for the animals?
That part I don't know. No, he didn't get into that, I don't think.
Wow.
The dog aspect, but did show an image of just the life cycle of ticks, and this Lone Star tick, I believed, had an additional opportunity or life cycle within the year or in the seasons, and so it's a little bit, it's next level. Yes, please. Oh,
Yeah, dogs don't get it because they have the enzyme in their body already that breaks things down, so they're immune to it.
That's good.
A pharmaceutical company or anyone who wanted to do research on how to cure alpha-gal syndrome will want to do it. They probably try to find out what produces them in certain animals and try to replicate that on a human scale.
yeah.
Thank you.
Yeah, Avi was there and was introduced to the Community Health Board, and Grace was there as our public health liaison at the time. Yeah, fill-in. So, and did the introduction. So, let's see here. Local Advisory Council for Mental Health, Ranna.
Well, we met, and we met here in person and also online. So, I don't know, was that the combination group? Okay, so we're experimenting with, I guess, having both groups come together instead of separate meetings. I thought it was great, really nice to be able to, for people who live close by like me, to come in person, and people who didn't have to, and I thought it was very good. We did talk about, future meetings, and we met Avi, which was great. And I don't know, we had a presentation from Birch Bark, I think, did we? So, do you want to say any more about that?
It was the similar presentation to what I gave at the all-staff meeting, so it was a chance for the advisory councils to know to go over what was in the report from Megan Mose and Birch Bark Consulting.
Good. Yeah, we hadn't met for a little while, so I thought it was really a good update to get back on track, kind of, and so.
When I was first elected, Commissioner Storlie probably was aware of this too. The two advisory councils were together, and then I thought there was legislation that required them to be separate, but Grace is going to look into that and just see, because it sounds like it was a really nice dynamic having both groups together. It makes a lot of sense, and we're such a small community, and very much a lot of overlap. So,
Yes.
Yeah.
Saves time for administrators who don't have to be in two meetings, so.
Well, thank you. Council on Aging, Commissioner White.
Well, food shelf, enthusiasm, a lot of grant opportunities out there, and we have a person who's pursuing those. So, and then of course, I will bring this up, the discussion of the board really wouldn't mind being a line item in the county's budget, so they wouldn't have to stress out all the time about how are we going to buy the new. I mean, I did get grant funding to buy a new refrigerator. So, I mean, this is nickel and diming. And they have 3 different CDs, so they have money in the bank, but they're on the edge. that way. So, and the number of people that continue to come in for services offered is just ever increasing. So,
Thank you.
so there's that.
I think we'll probably be talking more about that.
I told them we would.
Yeah. And how that might work or look, impacts. Emergency Preparedness Committee, Commissioner Sullivan.
Thank you, Mr. Chair. As mentioned last month, we did have an opportunity to have a tabletop exercise about winter storm and subsequent power outage, and so we had our after-action review. And then we had Seth Spencer from the University of Minnesota Extension come and talk about the Northland Climate Resilience Collaborative. And actually, for our community, there is a focus on climate resiliency this evening at Studio 21. I believe it's at 4:30. There's a meal served, and they're looking at collecting stories and information about how climate changes have impacted those people in Cook County. The U.S. Forest Service provided an update. They have a number of prescribed burns that are coming up. So Fiddle Creek, which is the Gunflint Trail, about a little over 10 miles. That's going to be 695 acres. It follows along the South Brule Road. There is another one that is near a Devil Track Lake Campground and the boat access on Devil Track, and that's a smaller portion that will be burned. That's 81 acres. Sunfish Lake, 775 acres, which is up by Greenwood Lake. And then over on the west end, Cowishui, which is almost 2,000 acres, and that's 18 miles north of Tofty along the Sawbill Trail. And then another section along the Sawbill, which is about 500 acres, that's 15 miles up. And then on Thursday of this week, the U.S. Forest Service will be doing their spring Gunflint Trail Ranger District meeting. It will be at the Shop Center from 3 to 5:30, kind of an open house style, so we would encourage people to come there, particularly people in District 4. And then for Commissioner Storlie on the west end, the Tofty or West End meeting is going to be in Isabella, and it will be from 6 to 8 p.m. at their community center. And that's all I have.
Thank you. NACO, Commissioner Storlie, you spoke to that a little bit already. I don't know if there's
Yes,
more.
about the
Yeah.
Medicaid. Then also, good discussion on increasing fundings for telehealth, as we probably have all experienced maybe some telehealth with physicians in Duluth, how great it is not to have travel for 2 and 3 and 4 hours, so hopefully we can work on that. So in February, when NACO had their conference in Washington, D.C., that was one of the things that they spoke to the senators about.
Thank you. Northeast Office of Job Training, Commissioner Gamble, anything? No, okay. North Shore Collaborative, we were not able to have a quorum, so we had to reschedule. Public Health and Human Services Advisory Council, it'd be Frank. Crystal, do you want to give a report, or Commissioner Gamble?
I don't have a report.
Okay.
Okay, Crystal did attend remotely during that meeting, and as already has been mentioned, it was a combined meeting, and I too felt that it was beneficial, very much an overlap in things, and I think the awareness is beneficial. If there is some statutory requirement that requires that they have to be independent, but Grace had mentioned that we would, the next 3 meetings, including the one we just met, that we would use as an opportunity to see. I suggested that if we look at what our mission statements are independently, to see how overlapped, or if in fact our purpose is a shared purpose, then it would seem to make sense. But that's something that could be evaluated. But I think anything that contributes to a better understanding and awareness with similar things would be beneficial. One thing I'd mention after the presentation on the Birch Bark report that we were privy to is that Grace, reviewing the report's recommendation with staff for restructuring the department's leadership to ensure that they continue to build strong systems of support as well as accountability for the department's operations. I mentioned in the meeting that given this report, the journey that we were on in the temporary interim director to where we are today, that this really is a case model that we can learn much from. And if you just want to take all of the things that were done and how we approached them and how we didn't allow the emotion or the confusion or the stress that comes with that, but this has been something that, the feedback that comes when the news gets out there and the alarm that is associated with hearing things, there needs to be the story that is told in the county's response to that, and how this has definitely been something that we can learn from, that can be applied. Very, very thoughtful, disciplined process that has led us to aligning a department with leadership that I think is going to definitely show the value of this process. The other thing, we were introduced to the Thrive Together, which is Cook County's online community resource guide. I think that'll be a very positive thing for those that have access to online. They can go on and it just, here's the resources, making that available. So that's something we'll be hearing more about. And then Cecilia Bloomquist from Sawtooth Mountain Clinic, there was an update on the council's joint efforts between the clinic and North Shore Hospital to improve the patient experience and coordination of care for individuals seeking mental health support in the emergency department. So we learned much about informing decisions in the food access this morning, and this is another example of listening and coming back with a response that's going to make it say to people that have real need that we hear you and we're trying to make things accessible. And then it was also noted that the behavioral health team is now fully staffed and new team members have been successfully onboarded and are integrating well. Sounds like kids are playing well, so that's good. That's it.
Thank you. Food Access Council, I mentioned at our last meeting that I missed that one because I was in the Labor Management Committee. And I also mentioned I was applying for a grant and I failed to get the deadline. So I've never actually been more disappointed in myself than that moment, but I've recovered and, life goes on and we'll pivot or whatever, but just wanted to give an update there. And for the good of the order, I just wanted to share a seagull pooped on my head for the first time since I was a kid. So that was pretty.
I've shared that experience.
That was just yesterday, right after a sauna. Yep.
Well, that has certainly enhanced my quality of life.
Yep.
Thank you.
Yep.
Looking for
I
one.
was standing around talking, that's what I get.
Hope there's not a disease for that, too.
Yep. Didn't even think of that. Also, Commissioner Gamble, yes, please.
Yeah, it's interesting. We watched a movie last night that's a movie that has an enterprising young man that wanted to become somebody that produced movies and filmed, and they had a sequence in the high school there where he was asked to shoot their party on the beach, and seagulls were a big part of that. Yeah. I was just going to mention that I think commissioners have received this, the National Association of Counties Central Region meeting agenda, which is today actually from 1 to 2. The topics they're going to be addressing will be rural energy, focus on the economic development of community engagement and safety surrounding nuclear, battery energy, storage system technologies, FEMA report, an update on the FEMA Review Council, including its recent extension and the latest developments surrounding the FEMA Act and broader federal disaster reform efforts. And lastly, new County Explorer profiles. This is an energy generation and consumption. It provides key energy statistics for every county in America, such as annual electricity consumption, residential electricity costs, energy generation jobs, and the amount of installed capacity for coal, natural gas, nuclear, solar, and wind. Those are the three topics on the agenda. Should we choose to get online, so.
Thank you. Anybody else? Commissioner Saul?
Very quickly, it is National Prescription Drug Take-Back Day. It started yesterday, Monday, April 20th, and through Friday, May 1st, community members can pick up free medication deactivation bags at the library and also here at the courthouse. And then year-round, there is disposal, which is available at the Law Enforcement Center. So just a reminder.
Thank you for mentioning that.
Yeah.
Where do we pick them up at, from here?
Right out.
All right.
You said take back, not kick back.
Take back. Purpose is to prevent accidental
Yeah.
ingestion, misuse, and overdose.
The library has them too.
Thank you. All right. Well, with that, we are adjourned.
Thank you all.
Hold it together.
We gotta scramble the tables.
That we do.